Health Guide is an app for learning disabled adults to help them manage their healthcare. It's available for Android and iOS, and it is available now. So if you have multiple devices, they're able to synchronise their data across the devices, and also to synchronise with a central location so that you as an app user can choose to share content with your health worker, who will then be able to access it via the web interface.
There's nothing out there in the market like My Health Guide, in the sense that it's not a top-down approach. It really looks to give adults with learning disabilities their own voice and give them primacy of control over the content of what's in their app and how they use the app, what matters to them, record what's important to them, and allow them the ability to communicate better with friends and family at a distance, but also their professional carers who they work with and see most days. We had one user who used the app for about 6 weeks or so, and she suffered from anxiety and depression, and she used the app to record her anxieties on a daily basis, like a diary, which we hadn't anticipated that it would be used in that way. And when she went for her regular checkup with her consultant psychiatrist and she showed him My Health Guide, and she spoke, he said, more eloquently than she ever had before, and he saw the impact that My Health Guide had in assisting in reducing her anxiety levels, he then discharged her from his care.
Well, I don't know if it's a world first, but it's certainly quite advanced in what it's doing. It's effectively like having a Dropbox sitting behind the application, so that everything you do in one place is automatically synchronized across to the other devices and to the web server. And we've had to implement a huge amount of work and specification to make that work. But what we have is something that's both generally usable and quite expandable for any future needs the app might have, and which works seamlessly from the point of view of the end user.
We really want to extend My Health Guide's reach to learning disabled adults across the country, and we think that it has potential to help learning disabled adults in a range of different scenarios, whether it's residential care or day service use, and we think that it will help those adults with learning disabilities to communicate about their lives, from things as trivial as doing the shopping and having their hair cut to their medication regimes. But we think that beyond that, the technology itself has applicability in a range of other areas, such as people with Alzheimer's and people with dementia and CAMS and SEN. So as the project progresses, we intend to roll out different versions to target different use cases.